Hello friends, welcome back to Complete Medical Coding. Today I'm here with some important ICD practice questions. I think it's been some time since we have not touched the ICD questions. So today I'm here with the some important ICD questions. This video is entirely based on only the ICD questions. Okay, so let's move to those questions one by one. Let's move directly to the first question. Moving to the first question. What is the correct way to code a patient having bradycardia due to demerol that was correctly prescribed and properly administered? So you have to code here. We have to find out the correct way to code a patient who is having bradycardia due to demerol, due to something, due to medicine or due to something. Means the underlying condition is there, bradycardia is there, but it has been caused by what? That is also mentioned in the question. Okay. So demerol, it's a medicine which was correctly prescribed and properly administered. So what is the correct way to code that? Okay. Let's go and check each and every codes one by one. You can open the ICD code book. Okay, you can open your ICD code book. What is the first one? What is the first option, first code? T40.2x1a. What is T40.2x1a? T40.2x1a is A represents the initial encounter. Okay, so poisoning by other opioids, accidental means unintentional. So poisoning by other opioids is that T40 code. What is R00.1? The next code in option A, R00.1. R00.1 is bradycardia, which we really need, right? Because the ICD code is that we have to code is for bradycardia. So that code should be coded first. And then followed by, it is caused by what? Alright, so that we have to, the sequencing should be like that. So since R00.1 is should be the primary code, our answer will be option C, but still we will check what is the other code, the secondary code in option C. Okay, so R001 along with the T code, which is T40.2x5a. So you have to code initially bradycardia and then followed by the adverse effect, or what is caused, the adverse effect that you have to code. So second code is T40.2x5a, which means adverse effect of other opioids, initial encounter. Yeah, adverse effect. So because of that, the bradycardia is being caused, right? So that is the adverse effect. So here the answer, as I told you, it will be option C. You have to code for bradycardia first, which is R001, and then the adverse effect, T40.2x5a. Adverse effect caused by other opioids, some opioids. Here it is demerol. Okay, that's how you need to find the answer. Hope you understood. Now moving to the second question. 55-year-old patient had a fracture of his left kneecap 6 months ago. The fracture has healed, but he still has staggering gait in which he will be going to physical therapy. What ICD-10-CM codes should be reported? So because of the patient was having a fracture 6 months ago, and because of that fracture, he is still staggering with a gait, right? So, and then he is undergoing physical therapy. So what is the ICD code here, diagnosis here? It is fracture of left knee. That's what you need to code. Okay. Anyway, let's go and find out the answer for this one. Just go to the first option, first code. It is the S code. Okay. S82.009A, which is unspecified fracture of unspecified patella, initial encounter for closed fracture. Here this is not, you cannot say everything unspecified if something specifically is mentioned, right? Because here we have specifically it's mentioned as left knee, fracture of left knee. So you cannot say unspecified fracture or unspecified patella. No, so that's wrong. So skip that option. Now let's go to option B. Again, it is the same, S82.009 S, which means subsequent encounter. That is also wrong. Moving to third, again the same, S82.009 S, which is also same, wrong. Okay, it won't come as the primary. What is the option D? R26.89. What is R26.89? Other abnormalities of gait and mobility. Other abnormalities of gait and mobility. Yeah. So here because of this fracture, he is taking physiotherapy, and then he is staggering, right? So what does it mean actually? Staggering gait. Staggering gait. What does it mean? So staggering gait means it refers to an unsteady weaving or swaying walk. The pattern of the walk is that. So in order to heal that, in order to get it done, or in order to heal that gait, in order to heal that way of walking, which should come perfectly or which should come as normal, he is undergoing physical therapy. So it means he is having some problem with walking. That is what it is mentioned as staggering gait, which is an abnormality in walking. Okay, it's a type of abnormality that can be caused by some underlying condition. Here, what is underlying condition? It is caused by due to fracture. So in the question, what is mentioned? The fracture has healed. So it means the fracture has already healed. Means currently he doesn't have the fracture, but he still has staggering gait. So it means currently what problem he is having, the patient is having. Currently the patient is having staggering gait, which means he is having difficulty in walking. For that he is going for physical therapy. So that you need to quote first, because just imagine if the patient is still having, if the patient's fracture is not healed yet, then you have to quote that fracture as primary. But the question is clearly mentioned as the fracture has been healed, and then the patient currently having staggering gait only. So you need to quote that one first, because that is the current complaint the patient is having, right? So you need to quote staggering gait first. So obviously it is in option D, which is coming primary, R26.89. Okay, so R26.89 means other abnormalities of gait and mobility, and then you need to code this fracture code, S82 here. Anyway, in the question it is not in the options, nothing mentioned, no option says about specified left knee or something like that. So go with the whatever option which is given in the question. In all the options it is specified unspecified fracture. It is mentioned as unspecified fracture. So go with that. Okay. But the only thing is, whatever the current situation the patient is having, that needs to be coded first. So here, gait and staggering gait should be coded first, followed by the fracture underlying condition. Okay. Which is S82.009S. So the answer here is option D. Staggering gait should be coded first, which is R code, and then S code, which represents sequela, unspecified fracture of unspecified patella, sequela. Yeah, S represents sequela. A is initial encounter, D is subsequent encounter, and S is sequela. Okay. Hope you understood. If you have any queries, please mark me in the comments. Moving to third question. A patient that has cirrhosis of the liver just had an endoscopy performed showing hemorrhagic esophageal varices. The ICD-10 codes should be reported. Which of the following ICD-10 that has to be reported. So here the patient is having liver cirrhosis. Okay, and then the patient performed endoscopy which shows esophageal varices. So esophageal varices also should be coded. Let's find out the options, the answers. Let's check out the codes one by one. Moving to the first option, first code, I-85.11. I-85.11 is secondary esophageal varices with bleeding. Okay, esophageal varices is given here. If you go option, let's find out the I code first. If you go to option B, same I-85.10. Secondary esophageal varices without bleeding. One is with bleeding and one is without bleeding. Now, if you go to here, there is nothing mentioned about bleeding. No. Is it mentioned? Yes, hemorrhagic esophageal varices is mentioned, which means it is with bleeding. So in our answer for esophageal varices, the code should be I-85.10. Sorry, 11. 11 is with bleeding and 10 is without bleeding. So in our answer, I-85.11 should be there, which is in options A and C. So you can directly skip options B and D. Okay. So if you go to option A and C, we already got one ICD code. What is the other code? K74.60. It's the same in both options. Only the sequencing is different. Obviously, the other code will be liver cirrhosis. So K74.60 is unspecified cirrhosis of liver. Here you have to code for the severity first, which is liver cirrhosis. So So you have to code for the K code first, which is liver cirrhosis. So the answer here is option C, K74.60, which is liver cirrhosis, and then I-85.11, which is esophageal varices with bleeding, because it is hemorrhagic esophageal varices. All right. Now let's move to fourth question. Following a MUGA scan, the physician documents the patient has developed congestive heart failure as an adverse effect of the trastuzumab. What is that? What do you mean by that? See, you will get some medical terms like this. Some which we know, even I also don't know. Okay, doesn't mean that we are perfect in everything. So I'll tell you what it is. Trastuzumab, which is commonly known as Herceptin, known by the brand name Herceptin. It's a monoclonal antibody medication. So it's a medication, okay, used to treat certain types of breast cancer, breast and stomach cancer. So it's a type of medication. Just try to understand only that. Okay, so the physician documents the patient has developed congestive heart failure as an adverse effect of the trastuzumab she received as a treatment for her breast cancer, okay, in the right breast, which is a medication. Just understand that it's a medication. The trastuzumab antineoplastic antibiotic therapy is being discontinued while he attempts to manage the heart failure pharmaceutically. Quote the patient's condition. So that medicine, that antibiotic therapy is discontinued while he attempts to manage the heart failure. Okay. So we have to quote this patient's condition. She's having the patient is having breast cancer. The patient is having what else? Heart failure. Everything you need to quote. Let's go and find out. Of course, the whole heart failure should be coded first, right? So which will be the heart failure code? Whatever which is related to heart, the codes will start with I. So I-50.9, which is heart failure unspecified. Anyway, it is the same in all the options. Okay. Now, if you go to second code in option A, T45.1x, 1A. T45.1x, 1A. which is poisoning by antineoplastic and immunosuppressive drugs, accidental initial encounter. If you go to, we will find out the T code first. Okay. So, poisoning by antineoplastic and immunosuppressive drugs. If you check the other one, T45.1x5A, adverse effect of antineoplastic and immunosuppressive drugs, initial encounter. What is 1x1A? Poisoning by antineoplastic. Here in the question, it is not mentioned that due to the medicine it is poisoned. No, nothing mentioned about poisoning, but adverse effect is because of this medicine. He discontinued and then doctor has gone for the treatment for heart failure. So, it is adverse effect. There is nothing mentioned about poisoning. So, you can't use the 1x1A code, T45.1x1A code, which is wrong. Okay. So, use T45.1x5A, which is in option B. That is the code which we need, adverse effect of some medicine. Alright. And then the C code. What will be the C code? Malignant, breast cancer. That also you have to code. So, malignant neoplasm of unspecified site of right female breast. It's mentioned as right breast. So, same. So, these three codes you should be coded. So, our answer will be option B. Heart failure code should be coded first. Adverse effect of the medicine should be coded next. And then breast cancer. Okay. Hope you understood. Let's discuss one more question, fifth question. 4 years post-hepatic transplant, the patient is diagnosed with combined hepatocellular carcinoma and cholangiocarcinoma of the liver. For the patient's condition. Carcinoma, hepatocellular carcinoma and cholangiocarcinoma of the liver. And which has happened 4 years after the hepatic transplant. Okay. Let's find out. Let's start finding out the answers, the codes. What is the first one? T86.49. T86.49 is other complications of liver transplant. Yes, because in the question it is clearly mentioned that after the hepatic transplant, after the liver transplant, 4 years later, all these things happen. So, that one should be coded first because it has happened because of a liver transplant, which is a severe one. Okay. So, complications of a liver transplant, you can say. And then if you go to option B, same option, the second code, C code, C80.2. What is C80.2? Malignant neoplasm associated with the transplant and organ. Yeah, transplant organ. Cancer, some cancer associated with the liver. It's already mentioned. Carcinoma, hepatocellular carcinoma, some cancer related to the liver. And then cholangio, that also you need to code. Cholangiocarcinoma of the liver also, which is C22.0, liver cell carcinoma. Yeah, that is cholangiocarcinoma. Cell. No, liver cell carcinoma is this one. Hepatocellular carcinoma. Hepato means liver. Cellular, cell. Okay, so liver cell carcinoma is C22.0 and cholangio. That you can code it however you want. But the thing is, T code should be coded first. The liver transplant, that should be coded first. And then the other two, C80.2 and C22.0. That doesn't make any difference. If you put it on secondary or as a third one, no, it doesn't make any difference. So, as I told you, here the answer will be option A. No need to check, no need to go and check the other options. Anyway, it's all the same, almost the same, all codes. Only the sequencing is different. And then some codes are different, yes. Anyway, we already got the answer here. So, here it is, answer is option A. T code, which represents liver transplant, complications due to liver transplant. And then the C codes, which represents both the cancer. One is liver cell cancer, hepatocellular carcinoma, and then the other one is cholangiocarcinoma. Okay, hepatocellular and cholangiocarcinoma. All right. means some, what can you say? Yeah, malignant neoplasm associated with the transplanted organ. Associated with, here the transplanted organ is liver. So because it's clearly mentioned in both the question, both the patient is diagnosed with both these diseases, hepatocellular and cholangio. So both you have to put. Hope you understood. I think I was little fast today. I don't know what happened. So anyway, friends, if you doesn't understood, please reply me or please mark it in the comments. I'll get back to you, or if you want, I can repeatedly take the same question again in the next video. I don't have any problem. The only thing is that you should be understanding. You should know what I'm explaining. Otherwise, no use of my, videos, right? Anyway, I'm so happy that many people are watching my videos and it is getting useful. I hope so. So friends, if you are new to the channel, please support me by subscribing to the channel and please share it among your friends. Thank you so much for all your support and stay tuned. We will see you soon in the next episode. Okay, thank you so much. Bye, take care.